The minority has made it clear that you don't want to participate in the process of rescuing the American people from the failures of Obamacare.
Senate will be in order.
It's been made clear to us that you don't want to participate in the process, and you are turning a blind eye to the people, the millions of people who are being hurt today by outrageous premiums, deductibles they can't afford, and a loss of choices because insurance companies have pulled out of the individual market. Your response to them is, we don't care. We care. And we're doing our best to deal with this. This is like going by a car accident where somebody's seriously injured, and rather than stopping and rendering aid, just driving on by. That's what our colleagues on the other side are doing. They're turning a blind eye, driving right on by a seriously injured person in a car accident. We are coming to the rescue of the people, the millions of people who are being hurt by Obamacare today. We would love to have our Democratic friends join us and do something truly sustainable. But you have to remember, my friends, how this started. Democrats jammed Obamacare through on a party line vote, and Republicans weren't able to participate in that process. So what we are trying to do is we're trying to save the people who are currently being hurt and whose health care has become unaffordable. If you would like to join us in this process, we'd love to have you. But failing that, we're going to get it done, and you can just drive right by the car wreck.
Mr. President.
Minority Leader.
Here's the correct analogy. Yes, there's been an accident. Yes, someone needs help. Someone who's not a doctor, not a physician, doesn't know how to help the patient. Our Republican friends go by the side of the road, but they don't know what to do. So the Democrats come by. We're doctors. We say we know how to fix this system. We know how to fix this patient. And the Republicans say, nope, don't come by, don't help us. We'll drive right by. And now the patient is ailing. But I'd ask my colleague, let's forget the past for the moment, because we got a much better argument than you. We had hundreds of amendments offered by Republicans that became part of our bill. I doubt there'll be a single Democratic amendment that will be. We had hours of hearings, hours of debates. You didn't. So you may not have thought the process was perfect. It's a lot more open than yours. But I have a proposal to my friend. Let us forget this draft bill. Let us right now, Democrats and Republicans, sit down and try to come up with a bipartisan bill. We're willing to do it today, now, this minute. Will you accept that offer?
Mr. President.
Senate will be in order.
Mr. President, if I thought that was a sincere offer, I would take it in a minute, in a New York minute. But it's not.
Senate will be in order.
The fact of the matter is that insurance companies are having to go to the state regulators as we speak to get insurance rates approved for 2018. That's the urgency that we are experiencing here. And then unless we act in an expedited fashion here very soon, we're going to see millions of people have their insurance rates raised by another double digits. It's been 105% since 2013. 105%. Obamacare was sold under the premise that families of four would see a reduction of $2,500. If you liked your policy, you can keep your policy. If you like your doctor, you can keep your doctor. All of that's false. False.